Okay, welcome back. We ended up with the last presentation with the nursing diagnosis or problem statement. So now we have assessed our patient. We have that cluster of symptoms or cues that direct us to our nursing problems, and now we want to plan for care. Okay, again, I have trouble with this first. There we go. Excuse me, ladies and gentlemen. Okay, so planning. This is our goals and outcome. It's a deliberate, systematic phase that we use to formulate our patient goals. And these are the basis for our nursing interventions. It's going to determine whether our interventions prevent something, reduce something, eliminate something, or improve something. And of course, we're going to use the nursing problem or diagnosis to help us determine what the intervention should be. We're also going to be using our assessment data. All of that merges together into this plan. It will involve decision making and problem solving. So you're going to put to use your critical thinking and your clinical reasoning for planning. And we do want to get patient and family input when possible. In the acute care setting, when so many things are kind of acute, it's kind of hard to think that we're going to include them. But having come from a home care background, that was very much a part of our planning. We had to see what the patient could and would do. So don't forget that the patient should be involved with our planning. So your book, if you see box 36-2 on page 22507 of your Pearson textbook, that's volume 2, um, that's the third edition, that newer book. It has a box in there that describes the differences between goals and desired outcomes. They're pretty much used interchangeably, and we're going to use them interchangeably when you're in the clinical setting and you are working on your care planning. So they are goals are the broad statements about a client's status, and the desired outcomes are more specific. And usually those include observable criteria, like the patient will walk 20 feet without shortness of breath, something that's a little more specific. Your book also gives you some very good examples. But the purpose, I think the important thing is the purpose of the goals and the desired outcomes. It provides direction for our planning. Okay, we have assessed the patient. We know that there are problems. We have defined the problems in our problem statement or nursing diagnosis. Um, so now we have to have a more systematic method of planning the care. We're just not going to go out there helter skelter. So it's going to provide us direction for planning. It also is a criteria for evaluating progress. If we set a plan in place, we've defined a problem from our assessment data. And so we're going to put a plan in place to either reduce, improve, uh, prevent that happening. So how are we going to know that we're being successful unless we have put a plan with goals out there? It'll help us determine if a problem has been resolved. And it may help the patient be motivated, and it may help the nurse motivate the patient by pointing out, oh, 2 days ago you could only walk 10 feet. Now, today, look, you walk 30 feet. And that provides the patient a sense of accomplishment, and the nurse as well, actually. It also supports the therapeutic nurse client relationship. You are working together as a team, and that shows your caring and concern, and that you have the patient's best interest in mind. So goals are identified from the problem statement or the nursing diagnosis. And so the questions you've got to ask yourself is, what is the need in the problem statement that is to be changed? Is there an intervention or healthy response that will correct the problem stated in the diagnosis? And can the patient achieve this? And how will the patient look and behave if this healthy response is achieved? What action must the patient or the nurse do in order to achieve this goal or outcome? So you want to follow this an acronym SMART. If you follow SMART, then you will always have a well-written goal statement or outcome statement. And again, I want to remind you that goals should be patient-centered. So SMART stands for specific action, measurable, attainable, relevant, and time limited. By specific action, it means that you are going to have one goal for each nursing diagnosis or problem. Measurable means what it says. We should be able to measure that progress. It's not going to be something like facilitate or the nurse will assist. It's going to be something that the patient can do or the nurse can do, something that can be done that is measurable. For instance, with our patient that we've talked about in the previous presentations with the pneumonia, we've now decided that that was pneumonia. We know that we need to increase fluids because increasing fluids helps thin the mucus secretions, so that will help get those secretions up. So if we wanted a goal that to help thin those secretions, we might say the patient will increase intake to 2,500 milliliters a day in the next 24 hours. So that's very measurable. It's attainable for most patients, and it's relevant. It's relevant because that's the action that we need to help thin the mucus so that the patient can effectively get that mucus up. And it is time limited. We said within 24 hours. So your goal statement needs to be a specific action, measurable, attainable, relevant. And when we say relevant, we could also say realistic. You could put a goal out there that is measurable, but we have to think about, is it really attainable or achievable? And is it realistic for that patient? We could say for a patient, well, this 80-year-old, we want to be able to give their own insulin uh, by 2 days from now. But what if that 80-year-old had poor vision and couldn't see to draw up the insulin into the syringe? Or what if that 80-year-old had severe arthritis and just manually didn't have the manual dexterity to handle that pulling up the medication into the syringe? So that's a good goal. It's measurable, and for most people it would be attainable and it would be relevant, but not for this patient. So you can see where we're going with the goal statement. It has to be patient-centered. We have to know our patients, and this using the SMART an acronym will help us keep us on the straight and narrow when we're writing goal statements. We want to write in terms of the client's responses, and like we said before, it must be realistic. We also need to ensure compatibility with therapies of other professionals. So that means we need to collaborate, let's say, with the occupational therapist, with the physical therapist, with the speech therapist. The patient may be having a swallowing issue. We may be saying we want this patient to increase their fluids to 2,500 liters, but if we see that speech therapy has been ordered, we need to check with the speech therapist. Is this realistic for this patient? Is there some kind of swallowing issue this patient may be having that's going to keep this patient from taking in that much fluid? We need to derive them from only one nursing diagnosis. So there is one goal statement for each nursing diagnosis or problem statement. Again, it's got to be observable and measurable, and we need to make sure that the patient considers it important to them. If it's not important to the patient is not going to be compliant with it. The patient is not going to work toward that goal. So we have to make sure that the patient is on the same program that we are. So the components of the goal or the outcome statement is we're going to have a subject, and that subject is just about always going to be the patient. So we need a subject, we need a verb, and we're going to need a condition modifier, and we need the criterion for the desired performance. Thus, we will have a goal statement. Let me go back. The subject, I think we did the example, the patient will increase fluids to 2,500 milliliters in the next 24 hours. So we said the subject, that's the patient. The verb, they're going to increase their fluids. The condition or the modifier is going to be the condition or the modifier has to do with thinning the mucus. We didn't necessarily put that in there. You don't necessarily. It just as long as you're covering that. And then the criterion for the performance, we want them to do it within the next 24 hours. So then that brings us to the fourth step in the nursing process, implementation, which we will cover in the next presentation.